This is The Goode Show. I'm Surinder, a proud military spouse of 26 years. My guy retired as a Command Master Chief after serving 30 years as a Navy SEAL. I'm also a mom, an entrepreneur, and an advocate for the military community. Here at The Goode Show, we delve into the inspiring lives of military spouses. From navigating deployments to building thriving businesses, we're here to empower, educate, and connect. So grab a coffee, get comfy, and let's get into it. Because The Goode Show is where your story matters. I told you she was coming in. Here she is, Dr. Georgine Nanos. Yes, how are you?
I'm doing great. How are you? It's so nice to see you this morning.
Listen, thank you for having me here because I know you've been in the middle of seeing patients. You've got other patients coming in. So I really appreciate, you having me in here today, especially because the first time I came up here, we started talking about this very specialized treatment that you're doing here.
Yes.
Right. And I had to go back and do some research on it because it's non-invasive. That's the thing that really got me.
Yes.
So I want you to tell us about, it's TMS. That's what it's called, TMS.
TMS, yes.
And what does TMS stand for?
So TMS stands for Transcranial Magnetic Stimulation. And that's a lot of words there. And what it is, the first thing I always say is it's not electric shock therapy. Everybody thinks it's that, but it's very, very different. And it is the best treatment we currently have in medicine for the treatment of anxiety, depression, and PTSD, and a whole host of other mental health disorders. And the way it works is you use magnetic field energy on your top of your head here, and there's no electric current or anything like that. And what it does is penetrate deep into the areas of our brain where our anxiety and depression centers lie. And everybody has these areas in the brain where if you are exposed to a lot of negative events, stress, trauma, you develop these negative pathways and loops in our brains. And sometimes we get stuck in that. And what the TMS does is help you get unstuck by creating these new positive pathways in the brain, so that after you're treated, when you get we're all going to have negative things come up in our lives. And so after you have a series of TMS treatments, when those negative things come up, you can cope and handle them much better, and your brain goes to those positive loops instead of the negative ones.
Now, is this a holistic treatment? Is that the right term for it?
I mean, it certainly is, in that there's no medication needed. It's non-invasive. Absolutely, yes, it is. It is an intense treatment. The beautiful thing about it is that there are no long-term side effects, which is not something I can say about anything in medicine. So by that standard, yes, it's a very holistic treatment. And it's FDA approved. It's been approved for over 17 years now, and it's been around for 35 years. But
wow,
a lot of people just don't know about it yet.
Now, you treat a lot of our retired servicemen and women that suffer from PTSD.
Yes.
Let me ask you, has this been approved by the VA? Do they go through the VA for this? Because that's like the number one question most people ask.
Yes. So when the FDA first approved this treatment 17 years ago, they had approved it. It takes 40 sessions to complete a treatment course of TMS. And when they first approved it, they approved it in a 40-day treatment cycle. So you had to go once a day for 40 days.
How long were you in for the day, though?
But just 15, 20 minutes tops. So it's very quick.
Okay.
But and this is part of the reason that it's not become more mainstream, is that not a lot of people can do anything for 40 days, let alone 4 days. And so people would kind of stop doing it in the middle and not get the benefits of it. So the VA does approve that kind of the treatment where you have to go for 40 consecutive days. And that's been approved for quite some time through the VA. So anyone out there who is a veteran or a dependent can get that treatment through the VA. That's absolutely available to them, and it's available through TRICARE as well. But you have to do the 40-day treatment. Now, what we do differently is, about 5 years ago, they came up with an accelerated treatment because a group of scientists at Stanford and researchers discovered that, why is nobody doing this? This is literally the best treatment we have, better than pills, better than, everything else we have to offer. And the reason was that 40-day cycle was just too much for people. So They studied a condensed version, an accelerated version done over 5 days. And so instead of coming once a day for 40 days, you come to a center and do the clinic once an hour, 8 hours for 5 days. So you're done in a week.
Oh, okay.
And that
Okay.
became known as the accelerated Stanford or SAINT protocol of TMS. And that's the one that we specialize in here. Unfortunately, that one has not yet been covered by insurance. And so what we have been trying to do is provide more access for veterans and service members to and their families to be able to do that faster treatment so they don't have to do the 40-day.
Yes.
So,
Yeah. Because
yeah.
I can't imagine going 40 days and going into some place for like 15 minutes
Yeah, it's crazy.
and then having to go back again. Now, no medication,
No medication,
non-invasive.
non-invasive.
What are the downsides? Are there downsides to this?
So there are no long-term side effects whatsoever, which is amazing.
Oh, yeah.
We treat kids as young as 12 here.
Oh, okay.
And the only possible side effect is you might have some scalp irritation or headache the day of and a couple days
Yeah.
after. But that goes away. So that's really it.
So when people come in for this, is this something that has been pushed out kind of like ahead of pharmaceutical, as in try this, or do people come in here after trying everything else?
That's a great question. So right now, people, because it's so not well known, people come because they've failed a lot of other things, whether it's therapy or medication. So we are usually the place of last resort for people. But what we want is for this to be the first line treatment for everybody because it's so safe.
Yeah.
So yeah, and
let me-
kids as well.
Now, a lot of my listeners are military spouses, and and you were a military spouse
I
as well,
was,
so
yes.
you get this. I mean, I don't think it's a military spouse thing. Hey, Joe, we've got Joe in the room. You can't see him. He looks very good, though. I got to tell you, Joe, isn't it a guy thing? I mean, it's normally women that have to follow up and say, "Hey, did you go to the doctors?" kind of thing. Do you know what I mean? Because guys just aren't
Yeah,
proactive in
no.
that, you know.
Yeah.
Yeah. So there's going to be spouses here that are interested in finding out more and connecting with you, because I think that's the way it normally works. We gather the information, then how do people get in touch with you?
So you can reach out to us through our website and you can call the office directly.
And I always say to people, there's Google out there. I mean, this morning to get directions, I quickly put kind health into Google and everything came up, So how have you got this in front of members of the military and got the word out there that this non-invasive treatment, because the non-invasive, to be honest with you, that's the key for me.
Yeah, absolutely.
There's no long-term side
It's
effects.
the key for me too. It's the
Yeah.
safest thing we have. Like everybody can benefit from it. It's
Yeah.
not just for people who have severe anxiety or depression. It's all or PTSD. It also helps with cognitive enhancement. There's studies out there that we're doing for Alzheimer's treatments. It helps you better emotionally regulate yourself. So even if I mean, really, there's nobody that has nothing going
Yeah,
on with
yeah.
them. Everybody's got something. That's part of the human condition. And it just helps you better control your emotions and just regulate yourself so you can deal with life where we have so much stress. I've had the treatment done. My whole family's had the treatment done. Everyone in this office has had the treatment done. So it just makes everyone function at a much higher level and just be their best selves. So it's pretty amazing. Our goal is to, have it available for everyone, without having to go through these insurance hoops and pay a ton of money, because it really is, it is a groundbreaking treatment.
I find, though, a lot of treatments like this, that holistic treatments, integrated medicine,
Right.
those things are just not covered, by insurances.
Well, this isn't quite like that because this is FDA approved. It has 18,000 studies behind it. It's a very, very powerful treatment. Like you can't get this like at any place. It has to be administered by a physician. It's a very serious treatment. Not to say that other holistic treatments aren't, worthwhile, but this is very different. This is a pretty intense medical intervention.
Now, do you do the treatment yourself? Like, do you perform the treatment?
I do sometimes perform the treatment. We also have a staff of highly trained technicians that do it. So I'm here all the time when it's being done.
Now, I'm going to speak to one of your clients to
Yes.
get, their input, but you've had it done. So tell me your experience, before and after. What did you notice about?
So for me, I have a lot of anxiety sometimes just by virtue of being a mother, a physician, and living in this world today is
Yes.
enough.
Yeah.
I think everyone does. And so I was going through a particularly rough time this past summer, and after I got treated, I was having a really hard time sleeping. I was actually waking up in the middle of the night having panic attacks, and it was very distressful for me. And after I got treated, within a few days, and everyone's experience is a little different as to how quickly they respond, but within a few days, I was able to sleep more soundly. I stopped having the panic attacks. The sleep for me was a big thing, and this it's also a very great treatment for insomnia. But insomnia tends to be part of other mental health disorders. Usually, if you're having insomnia, it's part of something else, usually anxiety. So for me, it was in the insomnia, the abatement of the insomnia, that I first noticed a big difference. And then I started to have like a greater sense of calm and centeredness, and like I felt more peaceful, which if you know me, I'm like the least peaceful person. I'm like always like radiating up here. So like you. So
Yeah, I need the
so
treatment.
yeah, I mean, I really recommend it for everybody. So
As you tell me when your changes start with it, like, do you have to complete the full treatment in order to experience any change, or is there a possibility as you're going through it you can?
So typically, it depends on which sort of treatment you do. If you're doing the 40-day treatment, it takes a lot longer, obviously. Usually by the 35th treatment, you start to notice some change. And that's usually in week like 7 or something like that, which is a long time, which is why it's frustrating for people because they kind of lose hope if they're not seeing some of these changes. In the 5-day treatment cycle, we usually notice some improvements in the second to last or the last day, and then after that you see incremental improvements every day for up to 3 months, and then at the 3-month mark you kind of know what your response has been.
Now, can you, if you need it again, can you get it done again?
Absolutely, yes,
Okay.
yeah. So what we say is there's really, everybody eventually responds. It's just a matter of how many times you have to
Yeah.
do it.
Yeah.
So and that's why the 40 days is so difficult for people because okay, I gotta go back for another 40 days.
Yeah.
That's like a lot.
Yeah, that
So
is a lot.
yeah, so we're working on ways to condense it even more from the 5-day into even a shorter time frame, but that's not hasn't been out yet. So
Okay, so now you're here in California in Encinitas.
yes,
Okay. So you're located closer to Camp Pendleton.
yes, yeah.
Um, but again, is this the only practice you have in San Diego?
It is the only practice we currently have in San Diego, but we are looking at expanding to the East Coast and other parts of the country in 2025. So we will have other ways to do this in other parts of the country.
Right now, to get the word out to members of the military, has it been mostly word of mouth?
It has been mostly word of
Yeah.
mouth. We've worked with a lot of veteran services organizations and some active duty foundations and that kind of thing to get the word out. But it is very challenging because it is one thing that we're trying to do is get foundations to support us to provide it for these veterans at no cost because again, they can always get it through the VA, but what we want to do is provide this much faster treatment. And so we're looking for nonprofit organizations to help support these military members. Well, the thing is, we can't really do it for active military until the VA approves this 5-day program.
That's right.
So the VA kind of owns your mind, body, the military owns your mind, body, and soul when you're in your active duty. So you can't really do it unless they're either retired or a dependent.
Yeah, I was going to say, because for those 5 days, I don't know, they'd have to take leave or something. So I understand to some extent why they do 40 days if you've retired, because it's almost like, well, you've retired now, you got 40 days.
Right.
But still, that's kind of soul destroying, I think. It's almost like going on a weight loss journey and you got to wait till the end to,
Yeah.
kind of thing.
Exactly.
Yeah.
So It is what we'd like to get people better faster. And
Yes.
right now, the only way to do that is, paying out of pocket, which is very expensive for some people. It's like a $15,000 treatment because
Yeah.
you're getting this it's very labor intensive. And then getting foundations and other organizations to help, sponsor, say, a veteran or a
Yeah.
service member, or I keep saying service member, or a veteran or a dependent, to get treated. And that's mostly how we've been getting people covered. And we also have our own foundation that we use as well to fund that. So right now, as we started this about 3 or 4 years ago, and we've donated over $1 million
Wow.
to pro bono treatments for underserved populations and veterans
That's
ourselves.
a lot of money.
It is a lot of money.
Yeah.
So if there's
That's
anyone out there
amazing.
that wants to help and
Yeah.
do more, that would be great. So it's very, to me, it's the most rewarding thing I've ever done in my medical career, to see such a profound change.
Yeah.
And it is a life-changing treatment for people. And I want everyone to have it.
I want to go back to, you'd mentioned earlier on, you'd had a young child at the age of 12 have the treatment.
Yes.
So, I mean, that's young.
It is.
But good to know that, again, no long-term side effects.
Exactly.
But how does that decision come about?
We treat every case individually. We assess every case individually. There are some centers that treat kids as young as 5.
Oh.
I just don't have that kind of patience.
That's
5 is
yeah,
pretty young, but and 12 is young too. The child has to be able to kind of sit still and tolerate being here for a whole week. We have to tolerate them. So I'm kidding, sort of.
I hear you.
So, but if the beautiful thing is, if you could do this for a child at such a young age and keep them off medication, what
Absolutely.
an incredible accomplishment. And she's the youngest child we've treated, is doing so remarkably well now, 2 years out, and has not needed medication. And
Wow.
it's just really, like, it's amazing.
Amazing.
We have hundreds of stories like these,
Yeah.
and it's just such a privilege to be a part of that journey for people.
Now, I'm going to see it again later. We're going to take some video of this being done. But I remember last time when I came up here, you got a quick session and you were awake. So it's not even like you're put under or anything.
No,
you're
not at
wide
all.
awake for the
Not
whole
at all.
thing.
Yeah, and each session takes about 3 minutes. So we usually encourage people to put together a playlist of songs, and we make it fun. And
Yeah.
it's nothing like taxing at all. It's not painful. It
Yeah.
shouldn't be painful. So a lot of people have told me they've gotten TMS in other places that's painful. If that's the case, there's something wrong. Like,
Yeah.
it shouldn't be a painful experience.
Yeah, because you were wide awake and then you got up and then we went off and we did something else. So that was a relief to see as well, because again, people who haven't had it done may not be aware. But I've got to ask you this as well. This has to be coupled with something. I mean,
Yeah.
it can't just, so.
So we require all of our patients to have a therapist before they start treatment, because we believe that TMS is just one very powerful tool in a larger mental health toolkit. It doesn't stand alone. It's not a silver bullet. It's not a magic one-time treatment. I mean, it is a little bit magical, but in order to get the lasting benefit, it's helpful to have a therapeutic relationship with someone that can help you work through all of the stuff that comes up after TMS. Because essentially what we're doing is, if people have had PTSD and any kind of trauma, and truly all of us have had trauma by virtue of being human. And a lot of that sometimes comes up after TMS, and all of that trauma that may not have been processed properly comes up, and you have to kind of reprocess that, and that can be really hard for people. So we do require that they have a therapist, and that they engage with that therapist on an ongoing basis before and after TMS, and sometimes during. So that's very helpful for people, and as much support as they can get. We have lots of people who are on medication. We don't recommend they come off the medication until they've discussed it with their doctor, at least 3 months after TMS. Some people end up staying on the same medication. A lot of them have come to us because medication didn't help them. They may end up going off of it. They may not. They may be on a lower dose. So that's something that they can come to an agreement with their doctor. at least 3 months after. And so if someone's starting TMS, if they're on something, we just say, stay on whatever you're on. We don't want to change too many
Yeah,
variables, and then go from there.
Is the result, do you think, a little different if somebody's actually on medication versus somebody who's not on medication? Have you noticed if there's a difference?
No, not typically. I mean, typically if they're coming to us and they're on medication, it's because that medication has not given them enough of a benefit.
Okay.
They call it treatment-resistant depression. So no, the same impact.
Crazy question, but how did they realize, whoever they are, that by, because what I saw in the room, and I mean, this is like real simple layman's terms, it was just like, being tapped on the head, really. That's what I thought it was,
it looks like, yeah.
And so I always wonder this, so what, somebody was tapping somebody on the head one day and they suddenly, I mean, how does it come to this?
Well, so it started about 35 years ago, and it looks random, but you actually are wearing a cap that is mapped to your specific brain coordinates where we have these target areas. So for example, this side here on the left side is called the dorsolateral prefrontal cortex, or the DLPFC, and that's the primary target area that we know in our brain where our anxiety and depression centers lie that I was talking about, the salience network. And so we do very specific mathematic algorithms before you get in that chair. It looks really simple, but there's a whole science behind it. And so there's different target areas for different conditions. For example, right here is the orbital frontal complex. That's where we treat OCD most effectively. So that's over here. And then in the middle, in the center here, we have the dorsomedial prefrontal cortex. And that's where we can treat sometimes bipolar disorder. And then just to the right of it, like 2 centimeters, is a new target area that was discovered earlier this year, more specific for anxiety. Even though we can treat anxiety here, this is more targeted for really difficult to treat anxiety. And we've used that a lot in studies for adolescents and young adults. So that's a huge part of our practice too. A lot of our younger people, especially after COVID, are really struggling with anxiety, just crippling anxiety. Can't really get out of it. And so typically in the summers, that is our busiest season because we see so many kids when they're out of school. And so we are really busy in the summertime treating high school kids and college kids and younger adults who are really struggling.
You mentioned bipolar. So obviously, and you said earlier on that this treatment is not just for PTSD. So it's PTSD, it's anxiety, it's bipolar.
Yep.
I mean, there seems to be
depression. It's also we can also help people with autism spectrum disorder, and some forms of schizophrenia. Not to say we're treating those conditions. We most certainly are not. But with the right patient, we can help them better function and regulate their emotions so they can lead more fulfilling lives in society. So we've seen quite a bit of that with great results, and that's amazing because those are really difficult to treat conditions or to manage. And so, for example, we've had a couple of people in their 20s, late 20s, early 30s with autism and with schizophrenic disorders. And they, wouldn't leave their house. They weren't functioning, and now they have jobs. They're out in the world. They're playing in a band, and it is truly life changing. Again, these have to be very carefully selected patients. We have to. It's a lot goes into selecting these patients and making sure they're the right fit for this.
Now, if I walked in through the door and said, "Hey, I think I need this," because you said,
I'd say, get in the chair.
And no doctors recommended me. I've just come in. I've just, read about it. What happens at that point? Like, do I have to go back to a doctor to get referred in? Would you guys take care of me from here and go, okay?
We would take care of you from here. So you would first meet with our intake coordinator, which is usually Joey, who would get an idea of what exactly you're looking for. And then he's kind of our first line there. And if you're, seem like a suitable candidate, then you'd meet with me or one of our PAs to determine, your whole history. We have an extensive intake process. We kind of ask everything about your life, all the medications you've been on, you know, your life experiences, and then we make a determination as to whether or not you'd be a good fit, and then we find a time for you in our schedule, and
Get it
we're
done.
off to the races.
Joey, have you ever had anybody that wasn't a good fit? Are there people that aren't a good fit?
Yeah, I think in any sort of medicine there are patients that aren't a good fit. But,
Yeah.
I mean, G's talked about the applicability of TMS all across the range of like mental health disorders and even just cognitive functioning to make that better. So while there are some patients that aren't exactly a good fit, I'd say it's a very low percentage.
Yeah.
Okay.
I'd say less than 1% even. Yeah. Very few people.
So success rate with this must be quite high.
It is quite high. Yeah, right now because we specialize more in the accelerated protocol, that in itself has a higher success rate because people are doing it and finishing it. Our rates tend to be a little bit higher than the national average. We're at 87%
Wow.
of a response rate. So we look at two things. We look at response and remission. So response means that you have some positive effect, which almost everyone gets.
Yeah.
So 87% of people will have a positive response. Remission is where you have a greater than 50% reduction in your symptoms, which takes a little more of a threshold to get to. And our remission rates are in the 70%, 75th percentile. So very, very high.
Yeah, these are good numbers.
Yeah, really great. Whereas for medication, remission with medication is much lower. It's in the 40s or 30s for some people. So, so overall, medication, this beats medication every time. Not to say that there isn't a role for medication at all. I certainly prescribe a lot of antidepressants, anti-anxiety medication. It's just a matter of finding what's right for each individual. And this is, you know, again, I'm not anti-medication. I just, if we can do something without it, great. But some people will always need it, and that's okay.
Yeah. No, I'm totally there with you. If you can get better without it, because I do believe that our bodies are made that way. You know, it's like, I have to say, somebody was asking me about taking something internally, and I went, listen, dude, I said, you know, and I know, if our mothers were in a field back in India, they'd be picking up something green, they'd be mashing it, steaming it, boiling it, mincing it. We'd either have it on us, or we'd be eating it or drinking it. You know what I mean?
Right, yeah.
And we'd be okay.
Yeah, absolutely. Yeah, I'm Greek, but we do the same thing in the Greek fields.
You know, I remember walking home with my mom one day after school, you know, a little Indian immigrant, and we walked past this house where the house is being knocked down, and my mother, like, spots mint growing in their backyard, and I had to go get it.
No, that's exactly what my mom would have done. I have done that. That is 100%. We are the same. Yeah.
I know, it's like anything green, my mom will pluck it, and then, you know, we'll eat it later.
Yeah.
But yeah.
I'm right there with you.
Yeah. It makes a huge difference. I tell people all the time, it really does make a huge difference. Now, I want to go over, before we wrap this up, how people get in touch with you again, so social media handles.
Social media, our website, kindhealthtms.com, is probably the best access point, because that gets you straight to us, and we will usually reach out within, you know, 1 business day.
That's perfect. Listen, I would like to come back when you have, because we're going to have your client come in.
Yes,
and
yes.
record
He's
a testimony.
he's a veteran, and he has a great story to share. I'm excited for you to meet him. His name's John.
Okay, I'm excited to hear it.
Yeah, so he's great.
How long ago did you come in for treatment?
It was August. Yeah. August. Yeah.
Okay.
Yeah.
And you were in the military?
Yes.
Navy?
Army.
Army. Okay.
Yeah.
That's a whole different conversation.
Yeah.
How long did you serve, if you don't mind me asking?
4 years.
4 years.
Yeah.
Okay.
Yeah.
So you decided to come in and get this TMS treatment. How did you hear about it?
It's through Dr. Nanos.
Okay.
Yeah.
Okay,
Yeah.
perfect. And tell me, before treatment, and you did the accelerated, obviously.
Yeah.
Before treatment and post-treatment, how do you feel?
It's made a world of difference for me. Prior to the treatment, I was dealing with all the symptoms of depression, right? The disengagement, the disinterest, the fatigue, just getting up for the day was, struggle to press through the things. And so I just knew I was at a point I was tired of that and tired of that effort and that routine every day. And so I reached out and came in for the treatment and pretty immediately I recognized the difference, right? And in the days following, right, I noticed some greater sensitivity and emotional awareness and sensitivity. But since then, and after the treatment, I felt engaged in my life. I felt kind of equipped to deal with things. The treatment does stir up things, and now I feel I have the capacity to deal with those feelings and emotions and experiences. So it's been transformative for my life.
Did you try anything else before the TMS?
Yeah, I was on depression medication. So I'd been under the care of my physician, and then also, therapy with a counselor. And honestly, I continue on the depression meds, but I find them effective.
Yes.
Whereas, just before they weren't doing anything. And then I've, continued in some therapy to deal with some of the feelings and things that come up in my life after the treatment process.
That's a really good point you just made about taking the meds, but them you feel that they were more effective because you cleared pathways.
Yes.
Yeah.
Yeah.
That's a really good point, because I'd asked Dr. Nanos earlier on, if people taking treatment during the TMS and those not, because it was vague in my head, like, why would you be taking medication?
Yeah.
But that makes a lot of sense.
Yeah, and I've talked with my primary care physician about this, and we have an appointment scheduled for January, and we're going to evaluate, next steps then. But I didn't want to rush off the treatment I was doing and include this in my whole life health. And so, it's been an important journey.
I want thank you for talking to me about it, because I think it's so important that people realize that even after you've served and what life itself, and that there are alternative things out there for them. And it's always good to hear what happened after the treatment. Again, the success rate with it is in the 80s. I mean, it's amazing.
Yeah. Yeah, and shining a light on behavioral health, right? It is normal, right? If we were to sprain our ankle, and go to the doctor, we'd take care of it. And if we had issues with it afterward, we'd still go back and take care of it. Same thing with our minds,
Yes.
right? And our behavioral health. So taking care of that. And, again, as a veteran, there are things in that experience, especially combat veterans, that we're trained, we see, we experience. And the process of dealing with those, it should be like morally challenging in a way. Well, not in a way. It is morally challenging. And creating mechanisms and finding mechanisms to cope with the moral consequences of engaging in combat is a need for our veterans. And so, yes, yeah.
I talk to a lot of veterans, and my husband just retired after 30 years of serving. And, a lot of them have that old school mentality, went to war, came home, didn't talk about it. And, just depress it, suppress it further and further kind of thing. And again, huge kudos to you, because I just think that it takes a lot for anybody to turn around and go, okay, this is the state I'm in, and I don't want to be here anymore, kind of deal,
Done.
Yeah.
Well, and I don't want to go too far,
Yeah.
Off a beaten path, but one of the things the military is great at is training its people. One of the things the military could get great at is helping its sailors, soldiers, airmen, Marines deal with the experiences they have without severe negative consequence, right? Somebody saying, I need to talk to somebody without being removed from their job, right? Because, and so, my encouragement to the armed forces is yes, this is a necessary thing, and we need to take care of our servicemen and women better.
Yeah, I've spoken to people that have said, you know, I don't want to say anything because my security clearance or it goes in my medical file, or it prevents, you know. So I would like to think as well, John, that after talking to all the servicemen and women I'm talking to, that things are definitely changing, and takes time.
Yeah.
You know, but definitely getting there.
Yeah.
But listen, thank you
Thank
so
you.
much.
Yeah, my
nice
pleasure.
to meet you.
My pleasure. Yeah.
I'm Dr. Georgine Nanos with Kind Health Group and Kind TMS. I am here today to deliver some very, very exciting news. We are so proud to bring one-day TMS to the world. We are revolutionizing mental health care starting today. TMS is a groundbreaking solution in treating mental health disorders, but imagine being able to get relief from depression, anxiety, PTSD, and a whole host of these other mental health conditions in just one day. What used to take months, weeks, and years sometimes, we can now accomplish in one day. That's right, one day. I'm going to say it over and over because it is truly amazing. It is a result of tireless innovation and commitment to our community and our patients, and in helping to deliver life-altering treatment for them. We are so proud to be the first center in the world to accomplish this goal of delivering one-day TMS. And now it's available to everybody. So we want to shout it from the rooftops. I certainly do, and I am all the time. And if you are suffering from anxiety or depression or any other mental health disorder, or someone you love is suffering, please reach out to us. We can help you in a way that you have never experienced before. One day, fast, easy, efficient, and safe.
Thanks for tuning in to The Goode Show. I hope you have been inspired by today's conversation. If you loved what you heard, help us spread the word. Follow me on Instagram @The Goode Show. As military spouses, we all have stories to share, experiences, resources, and support. I want to hear your story and highlight your business. Let's connect, DM me, or visit surindergoode.com to share your journey. Until next time, take care, stay inspired, and keep doing good things.